In today's class, we are going to simplify hypertension and its management. First, imagine this as a normal artery where blood flows smoothly without any resistance. The passage is wide open so the heart can pump blood easily throughout the body. Now, what happens in hypertension? Take the same artery over time due to different causes. For example, fat buildup inside the blood vessel. The passage become narrower. Now, heart has to push harder to move blood through that tight pathway. This increased force of blood towards arterial wall, which is high blood pressure. Alright, so why do we usually measure blood pressure from the brachial artery? Well, there are two reasons. Main reason is that it is close enough to the heart, so it is easy to find what actually happening centrally in the body, making it clinically meaningful. Another big advantage is that the brachial artery is easy to access. It runs along the upper arm, so placing the cuff here is very simple. So in short, it is close to the heart, easy to reach and gives us reliable standardized result. That's why the brachial artery is the go-to site for measuring blood pressure. Now let us understand the different blood pressure categories in a simple way. First we have normal BP. This is when the systolic pressure is less than 120 and diastolic is less than 80 millimeters of mercury. Next is elevated blood pressure. Here the systolic is between 120 to 129 while the diastolic still remains below 80. Then comes stage 1 hypertension. This is when the systolic pressure is between 130 to 139 and the diastolic is between 80 to 89. After that we have stage 2 hypertension. This means the systolic pressure is 140 or higher and the diastolic pressure is 90 or higher. There is also something called isolated systolic hypertension, where only the systolic pressure is high while the diastolic pressure may remain normal. And similarly, isolated diastolic hypertension, where the diastolic pressure is high even if the systolic pressure is normal. Now let's classify hypertension based on its cause. Hypertension is mainly divided into two types: primary, or also called as essential hypertension, and secondary hypertension. Let's start with primary or essential hypertension. This is the most common type, and the important thing here is there is no clear single cause. It develops gradually over time rather than suddenly. That's why many people may have it for years without noticing any symptoms. That's why it is also called as silent killer. Even though there is no exact cause, there are several important risk factors that increase the chances of developing it. These include old age, obesity, eating too much salty food, and having sedentary lifestyle. The good news is that primary hypertension can often be improved with lifestyle changes like regular exercise, healthy eating, reduced salt intake, and maintaining a healthy weight. Now let us talk about secondary hypertension. Unlike primary, secondary hypertension happens as a result of another problem in the body. Common cause is low renal blood flow. That means reduced blood supply to the kidneys. When the kidneys are having less blood flow, the trigger mechanism, for example, renin-angiotensin mechanism, that will raise blood pressure. Another causes include atherosclerosis or fat deposit inside the artery wall. Then vasculitis, which is inflammation of blood vessel. Another cause is aortic dissection. See the picture here. It is a tear in the inner wall of aorta that allows blood to split between the layers of the vessel wall and cause rise in BP. Another cause is fibromuscular dysplasia, which is more common in young women and cause abnormal thickening of the arteries. Sometimes even a tumor can lead to secondary hypertension by affecting hormone levels or blood flow. An important point to remember is that in secondary hypertension, the symptoms are often related to underlying cause, not just the high blood pressure itself. Now let us understand hypertensive crisis, which is very serious and dangerous rise in blood pressure. It is mainly divided into two types: urgency and emergency. First, hypertensive urgency means the blood pressure is extremely high but there is no damage to the end organs. On the other hand, hypertensive emergency means the blood pressure is very high and there is damage happening to the end organs. These end organs commonly include brain, heart, kidneys, and lungs. Patients may show warning signs such as confusion, drowsiness, chest pain, and breathlessness. These symptoms should be never ignored because they may indicate serious organ damage and require immediate medical attention. Now let's look at the risk factors and investigation for hypertension. Risk factors include high alcohol intake, diabetes, and dyslipidemia or abnormal cholesterol levels, obesity, sleep apnea, and metabolic syndrome. A high salt intake is also a major contributor because excess sodium increases blood pressure. We also see higher risk with old age and positive family history. Now coming to the investigation. One common test is ECG, which helps assess how hypertension may affecting the heart. Urine analysis is done to check the kidney function. Doctors also do serology tests such as measuring plasma renin and plasma aldosterone, which help identify hormonal causes of hypertension. Tests like TFT or thyroid function test and FBC full blood count are also useful to rule out the secondary cause and assess the overall health. Coming to treatment, regular exercise, reduced salt intake, and limiting alcohol are very important. Following a healthy diet, quitting smoking, and taking antihypertensive medicine regularly all plays a key role in controlling blood pressure. Treatment is a combination of these right medicaments and a healthy lifestyle. Now let's discuss the treatment of hypertension in different clinical conditions. For stage 1 essential hypertension, the commonly used first-line medications are ACE inhibitors or ARBs, thiazide diuretics, and calcium channel blockers, also called CCBs. These drugs help lower blood pressure effectively and are commonly used depending on the patient's condition. In patients with post myocardial infarction or after a heart attack, we usually prefer beta blockers, especially metoprolol along with ACE inhibitors or ARBs. This is because these medicaments helps to reduce the workload on the heart and improve long-term outcomes. Then for patients with heart failure, treatment commonly include beta blockers or ACE inhibitors or ARBs such as losartan and spironolactone. For patients with coronary artery disease, use beta blockers, calcium channel blockers like amlodipine and nitrates. These drugs helps improve blood flow to the heart and reduce chest pain. In patients with diabetes mellitus or chronic kidney disease, the preferred drugs are ACE inhibitors such as lisinopril or ARBs. These are not only control blood pressure but also helps protect the kidneys. Now in pregnancy, we have to be very careful with the drug choice. Safe options include hydralazine, methyl dopa, labetalol and nifedipine. Let's talk about hypertensive urgency and emergency situation. In these situations, intravenous antihypertensive drugs are used, but it is very important not to reduce blood pressure too quickly. Why? Because a rapid drop can reduce blood supply to the vital organs that may cause complications such as encephalopathy, which worsens the conditions. So instead, BP should be reduced gradually over 1 to 2 days in a controlled manner. Common IV drugs used include nicardipine, esmolol, nitroprusside, usually given as titrated infusions. So here we wind up the video on hypertension. I hope this video helps to understand about the condition and its management. Comment your doubts below, stay healthy and we will meet you in another health related content.